we're good. You want to admit that person? I mean, it's probably someone from your department.
I don't see them.
662-9356. Oh, you're not even a ghost anymore. I didn't make you host. You are host. If you could just make me co-host.
And also Joyce needs to be co-host.
Well, I did. I thought. Oh, maybe I didn't.
Yeah, it's not showing.
All right. Well, George, you're host, so you can make us both co-host.
There's that number. It appeared again. 466 number. Wait a minute. Hold on. No, 662 number. Thank you, George.
Betsy, do you need to be host or co-host?
Co-host, please. Yes.
And the cart is there.
Okay, good. So yeah, George, you just need to make the captioner co-host as well as assign captioning.
Hi, Carolyn, can you, so I've assigned you to captioning. Can you do a test for? Looks good to me.
Looks good over here.
Great, thank you. Thank you, Carolyn.
George, did you find out who was the 662 number, 9356?
I think it's Cecily.
If you want, she can have her. If whoever 662-9356, can you rename yourself, please? And who's RMC?
That's definitely Cecily.
Okay. Looks good on YouTube. I'll just be standing by if you need anything.
Hi.
Hi, everybody. This is George. We'll be starting in just a few minutes, so hang on.
Hello.
Good afternoon. This is George. We'll be starting in just a few minutes. Good afternoon, everybody. This is George. We're just waiting for Rose Palmer, our chair, and then we'll go ahead and get started. Thank you. Hi, good afternoon. This is George. Could you, somebody just joined with a phone number, if they could identify themselves, please?
Hi, George. That's probably me, Betty.
Oh, hi, Betty. Okay. Is that 804-714-9577?
Yes, that's me.
All right, great.
Hi, everyone.
Good afternoon. Hi, Rose. So, Rose, now that you're here, if you'd like, we can go ahead and get started. I'll start with the housekeeping announcements.
Sounds good.
Okay. So good afternoon. This is George Worthington with DARS. So I have a few housekeeping announcements. We do have a lot on the agenda today, so we'll need to be very diligent and conscious of our time today. This meeting is being recorded and minutes are being taken. If you would prefer not to have your video showing, you can turn your video off. Due to the active state of emergency, this is an electronic meeting pursuant to item 4-0.01 of the 2020 Appropriation Act. Meeting notice has been provided. The meeting is being recorded and minutes are being taken. All votes will be conducted by a roll call of voting members. Meeting materials are posted under the Public Guardian and Conservator Advisory Board's quarterly meeting tab at the link posted on the agenda. And members of the public are able to live stream this meeting via the DARS YouTube page. Please be advised that if the live stream is interrupted, we will need to pause the meeting until it is restored. Public comment will be accepted by email or phone to my attention. Public comments that were received by September 28th, 2020, so yesterday, will be read or, if lengthy, summarized during the meeting when we reach that agenda item. You're probably all familiar with Zoom by now, but just in case you're not, please keep yourself muted. Unless you're speaking, that helps to reduce background noise. Also, before you speak, if you could please state your name. So not only does this help your colleagues on the council know who is talking, but it also helps Cecily with documenting the minutes. And this is particularly important as committee members will be discussing recommendations and our captioner will be trying to caption the discussion. Members, if you have your video enabled, please be aware the system may capture your image and video in the public streaming and recording. You may use the chat feature as well, but please don't use that in lieu of speaking, as it can't be viewed by the public. But if you have some technical issues, please use the chat. If you'd like to view the real-time captioning of today's meeting, please click on the CC button on the menu bar at the bottom and select Show Subtitles. Zoom participants will have turn on closed captioning. The YouTube streaming will automatically include the captioning. And video options are in this area. You can set yourself. Some features will be set by us. And for all votes, we will do a roll call and you will be asked to indicate support, either yay or yes, opposition, nay or no, or abstain. And lastly, I'd like to thank the DARS video conferencing team and the DARS communication team for making this electronic meeting possible. So I'll do a quick roll call to confirm members in attendance. So please answer here when I call your name. I'll go alphabetically. James Almond.
Here.
Great, thank you. Kathy Harkey.
Here.
Kimberly King.
Here.
Monica Karavanich.
Here.
George McAndrews.
Here.
Rose Palmer.
Here.
Angie Phelan.
Here.
Sarah Ragland.
Here.
And LaTroy Roxburgh, let me know she'll be late. Christy Zed.
Here.
Great, thank you. So Rose, we do have a quorum. So if you'd like to go ahead and start the meeting.
Welcome, everyone. Glad to have everyone joining us today. We do have a lot on the agenda today, and we would appreciate it if you take a moment and review that agenda so that we might adopt it. Oh, I apologize. I skipped right over introducing ourselves and letting everybody know who each of us represent. George, do you want to go ahead and call a list? Do it by roll call, or do you want me to?
If you'd like to start, and then I can call the others.
Okay, I'm Rose Palmer. I am currently the chair of this board, and I am a private attorney who is appointed to the board as a general citizen. Do not represent an organization. I'm a family law and elder law attorney, and I am glad to have everyone here.
Great. Thank you, Rose. Judge Almond?
I'm Jim Allman. I'm a retired circuit court judge from Arlington and the city of Falls Church.
Great. Thank you. Kimberly King?
Hello, everyone. I'm Kimberly King. I'm a community integration manager with the Department of Behavioral Health and Developmental Services.
Thanks. Monica Karavanich?
Hi, good afternoon. My name is Monica Karavanick, and I am Director of Operations at the ARC of Southside, and I am representing the ARC of Virginia.
Great. Thank you. George McAndrews?
I'm George McAndrews. I'm an assistant city attorney in Alexandria, and I represent our mental health department. I'm a citizen member on the board.
And thank you. Apologies, I skipped right over Kathy Harkey.
Hello, I am Kathy Harkey, and I am the Executive Director of the National Alliance on Mental Illness of Virginia, or NAMI.
Thank you. Angie Phelan?
Hi, I'm Angie Phelan. I'm at Senior Connections, the Capital Area Agency on Aging, and I'm here representing the area agencies on aging for the state.
Great, thanks. Tara Ragland? Tara, if you're talking, you're muted.
Sorry about that, guys. And I can barely hear, so can you repeat that a little bit for me?
If you would just introduce yourself and,
okay,
and
yeah, I'm
your
trying
affiliation.
to get my thing together here. That's a whole nother story. But anyway, Tara Ragland, I'm the Division Director for Licensing Programs at the Department of Social Services.
Great, thank you. And Christy Zed.
Hi, good afternoon. I am the Chief Operating Officer of Developmental Services at Richmond Behavioral Health Authority, and I'm representing the Virginia Association of Community Services Boards.
Great, thank you. And we'll go to DAR staff, Marcia Dubois. Marcia, I think you're muted.
As you all may have noticed, I'm having some connectivity problems. Can you all hear me?
Yes.
I'm Marcia Dubois. I'm the Deputy Commissioner for the Division for Community Living. And if I have any more problems, I'm running down to the conference room where Cecily is to give my report. So we'll see how this works. Thanks.
Thanks. Kathy Miller. Okay, Kathy may not have a microphone. Betty Vines.
Hi, I'm Betty Vines, Program Specialist for the DARS Public Guardianship Program.
Great, okay. Have I missed anybody? Okay, all right, Rose, well, let's move on.
Now let's try that again. Let's, if you'll review the agenda, and can we have a motion to adopt?
George, I move that we adopt it.
Do we have a second?
I second. This is Monica.
We need a roll
Okay.
call.
We do need a roll call. So if you could answer yay, nay, or abstain. Jim Almond,
Yes.
Kathy Harkey,
Yes.
Kimberly King,
Yes.
Monica Karavanek,
Yes.
George McAndrews,
Yes.
Rose Palmer,
Yes.
Angie Fallon,
Yes.
Tara Ragland,
Yes.
thank you, and Christy Zed.
Yes.
Great, thank you. So that's a vote to adopt the agenda. All in favor?
Motion carried. The next item on our agenda is LaTroya with us?
She's not. So she called me a few minutes ago to say she would be a little late, but she didn't want to hold things up. So she had not noticed any changes or amendments to the minutes. So we can go ahead and adopt those if everybody's okay with that.
Has everyone had an opportunity?
I had one correction, I think. On the beginning page of the minutes, the date is listed as June 10. It should be 11.
All right. Yes. Yes, it should be. Okay. Thank you for catching that.
Thank you, Judge. Are there any other items to be discussed or changed? We need a motion to adopt.
No, you can go ahead and adopt those as amended.
All right, then we will adopt as amended. The next thing on our agenda is public comment. Do we have anyone, George, that would like to make any comments? I don't know how that works with the YouTube streaming.
So we would have to have had written or telephone public comment received prior to the meeting. None was received, so we can move on.
Off on we go. Okay, now we need a vice chair. George, do we have anyone who has agreed to do that? I think I've lost count of where we were on that.
So yes, Christy Zed had indicated that she would be interested in be open to serving as vice chair. If anybody would like to nominate her.
I was going to nominate her.
Right. Sorry, who was that?
I'll second the nomination. Jim Allman.
I think we have a nomination in a second.
Second.
Yes.
Do we need
Are
a
there
roll
any
call?
other nominations?
Do you need a roll call for that to finalize her?
We do, but just want to check if there are any other nominations from the floor. No. Is there a consent to close the nominations?
So moved.
Yes.
Okay, so let's so we'll have a roll call. The following vote is to elect Christy Zed as vice chair to fill out the term that will be expiring June 30th, 2021. So I'll do alphabetic roll call. Jim Almond. Sorry, Judge Allman, I didn't hear you.
Yeah.
Yes, okay.
Jim Allman votes yes.
Kathy? Okay, thank you. Kathy Harkey?
Yes.
Monica Karavanek?
Yes.
Kimberly King?
Yes.
George McAndrews?
Yes.
Rose Palmer?
Yes.
Angie Phelan?
Yes.
Tara Ragland?
Yes.
And Christy Zed?
Yes.
Right, okay. So there was a unanimous vote to elect Christy Zed as vice chair.
Thank you, Christy, for stepping up. I look forward to working with you. Now we have Marcia DuBois' report. Marcia, are you able to go forward?
Yes. Can everyone hear me?
We can.
Yes.
We can.
Okay. Well, good afternoon, everybody. I will try to cut some of my report a little bit shorter since I know we're tight on time. First, I just wanted to start off with some updates from our Office for Aging Services. DARS, the Office for Aging Services, worked very closely with an area agency or AAA work group to develop and disseminate a congregate site reopening best practices resource guide for the AAAs to utilize. And this tool is a reference for the AAA directors when determining the best course of action for each program when they consider congregate sites reopening. And this is now available on our provider portal on their website for easy access to all AAAs. And we just want, our Office for Aging Services just wants to really thank this work group for their quick convening and for their efforts in getting this done. So a big thank you to the AAAs for working with us to get that out. It's really been helpful. We've received a lot of positive feedback for that. Also, our collaboration with the AAAs and V4A, you all are well aware over the last year or so, at many of our meetings, we were talking about looking forward to the Governor's Conference on Aging, and then we postponed it twice, actually, due to COVID, and it is on the calendar for next May. But the Governor's Conference on Aging Planning Committee is doing something really exciting to not only keep engagement, but to really utilize the creativity of a lot of the program planning that's been happening. And so what they've done is they're hosting a series of webinars on various topics. The fourth Tuesday of each month from 1 to 2 p.m. And George can send out the link to you all, but I really encourage you to just check it out, to sign up for these webinars, or you can access previously recorded webinars. And you know, some of the ones that have been held previously have been social isolation, long-term care, social isolation and community-based services, issues revealed for older Virginians by the pandemic. On that one, Dr. Pam Teester was one of the presenters, but I just think it would be really great if you all were able to check these out. So go ahead and sign up and see what's there at your own leisure. Some of our grant updates. We were awarded some additional funding for the State Health Insurance Assistance Program, or SHIP, in Virginia. You all may be more familiar with the term VICAP, or the Virginia Insurance Counseling and Assistance Program. And we were awarded an additional $115,000, which will really benefit this program a lot. This program is primarily carried out through volunteers that provide free, unbiased, confidential, and personal assistance that allow a trained counselor to walk through the steps to maximize an individual's benefits. And of course, now we're entering into Medicare open enrollment from October 15th to December 7th. So I'm sure you probably have a friend or family member who might benefit from that important program. So we're very excited about that. Also, the Administration for Community Living, or ACL, awarded DARS a 1-year no-cost extension for its 2017 Falls Prevention Grant. And some of the things happening with this grant are that one of the programs, our Matter of Balance program, had to be changed and limited due to Maine Health's decision to discontinue that program. But DARS had a grant balance remaining anyway, so we've been able to not only continue, or may be able to continue a portion of that, but we'll be able to introduce what's called bingo size to the Commonwealth while continuing to spread Matter of Balance, whether in person or virtually when the time is right. So we're really excited about that as well. And also, we just finished Falls Prevention Week, which was September 21st through 25th. So we had a lot of exciting events scheduled for that as well. And then finally, on our grants update, the USDA awarded DARS a third and final allocation for the Seniors Farmers Market Nutrition Program. And so that brought our 2020 funding equal to our 2019 funding. And this program allows the community to support the farmers in Virginia, as well as low-income seniors and WIC participants, by providing fresh fruits and vegetables directly from the farmer's field to recipients via Virginia's farmers market and roadside stands. So to date, DARS has approved 201 farmers, 22 new growers, and 62 participating farmers markets and 32 roadside stands. Also wanted to just give a reminder out there, we mention this periodically, but we still have the Lifespan Respite Care Voucher program, and DARS continues to operate this program, which provides reimbursement of up to $400 per family, caring for individuals in need of respite services. And so we're just beginning the last year of a 3-year grant, and applications are available on our website. And then finally, just wanted to give you several updates with our No Wrong Door program. No Wrong Door is very excited to finally roll out verbal consent for its electronic referral portion, which they've been working on for some time. So this really allows, particularly in time of COVID, to streamline the referral process electronically for members on its system. And so we've been excited about that. And then also, No Wrong Door received a grant through COVID relief that's allowed it to expand capacity for its networks and partner not only with SILs and area agencies on aging and other programs to expand capacity, but also to partner with the Virginia Assistive Technology System to get technology kits out to older Virginians. So those are some exciting things happening in our programs. And one of the final things I just wanted to leave you with, as you're well aware, the census is wrapping up. So we just wanted to send a reminder to make sure that your friends and family do complete the census if they haven't already. The census figures heavily in determining how much the Commonwealth receives in Older Americans Act funding. So of course, we know that that's very important to the work that we do. So that's it. If anyone has any questions, I'd be happy to answer them.
Thank you, Marcia. We really appreciate your time. Is Charlotte online, George?
No, she's on leave. She's asked me to do her report.
Okay.
So I will go ahead and do that. So everybody, this is the update on the fast track regulation project for the Public Guardian and Conservator program regulations. Everybody received a handout with their meeting materials. So I'm going to just summarize that for you. If you have any questions, I may have to take them on notice and ask Charlotte, because I'm not fully up to date with this. But as you may recall, the enabling statutory authority for the Virginia Public Guardian and Conservator program is found in sections 51.5 to 1-149 to 51.5-151 of the Code of Virginia. Under this, DARS promulgates regulations for the operation of the program. So DARS, the Department for Aging and Rehabilitative Services, promulgates regulations for the operation of the program, and these are found in 22 Virginia Administrative Code 30-70. So Charlotte Arbogast, the policy analyst at DARS, presented to the board on June 11th on the fast track process and on the proposed regulatory changes. So the fast track process is for rules that are expected to be non-controversial according to section 2.2-4012.1 of the Code of Virginia. At that meeting, members of the board expressed general support for the proposed changes that align the regulations with current practices and code requirements and improve the readability and clarity of the regulations. One area of concern that members raised was over the proposed additional degree requirements for program directors, as these were felt to potentially exclude qualified people with years of experience but no degree from being considered for the positions. DARS noted this feedback and also received feedback from the 13 Public Guardian program contractors. Since then, DARS has proceeded with the executive review process. The fast track action was first approved within DARS and received certification from the Office of the Attorney General on August 20th. The action then went to the Department of Planning and Budget, which determined that the revisions were appropriate for the fast track process. The Department of Planning and Budget developed an economic analysis, impact analysis, and a policy analysis. So the economic impact analysis was published yesterday and is available on the Virginia Town Hall website. And the policy analysis forms part of the governor's confidential working papers. The action is now under review with the Secretary of Health and Human Resources. So the key takeaway from this is that the fast track action is still moving forward and is under executive review. DARS will keep the Public Guardian and Conservator Advisory Board updated as the fast track action progresses and in advance of any publication in the Virginia Register and the public comment period. We don't yet know when that will be. Any questions on the fast track process? No. Okay. So the next section is the periodic review, which is conducted every 4 years to determine whether the regulations should be continued without change or be amended or repealed, whether they are consistent with the stated objectives of applicable law, and whether they minimize the economic impact on small business. So I won't go through all of that. You do have it on your handout. The key takeaway there is that DARS has initiated a periodic review of the Public Guardian and Conservator program regulations as per that process. During the upcoming 21-day public comment period, individual board members of the Public Guardian and Conservator Advisory Board may make public comments, or if there were to be a proper vote by the board may also make a public comment itself. Now, this is optional, it's not required. And the public comment period will run from October 12th to November 2nd, 2020. And I suspect if you have any questions about that, you should contact Charlotte directly. Her contact details are on the handout. And that's all for me, unless anybody has any questions Rose, you're on mute.
Thank you, George. I appreciate that. If anyone has any questions, I would suggest either contacting Charlotte or at the, you can email me or you can email George and we will have Charlotte get back to you. The next thing on our agenda is the public guardianship program updates. Is Patty Muir available?
No, she's not here today, so Betty Vines will be delivering her report.
Hi, Betty.
Hello, everyone. Can you all hear me?
Yes, we can.
Oh, okay, great, sorry. Okay, I'm gonna start with client data. The 13 local public guardian service providers are doing a great job, as usual, keeping their slots full. The program has a total of 1,049 slots. As of June 30th, 2020, the end of the fourth quarter state fiscal year 2020, reports from our local providers show that the program had 976 active clients with a court order establishing a public guardianship. 56 offers were outstanding to individuals who have been accepted for public guardianship services but require a court order to begin the guardianship process, and 17 open slots. Broken down even further for the 17, there were 14 unrestricted slots, 2 DBHDS ID slots, and 1 DBHDS mental health slot. At the end of fiscal year 2020, there were enough individuals on the waiting list to fill all of these slots. During state fiscal year 2020, we had 110 court orders that were entered appointing a public guardian. And of course, this was an increase from the third quarter of fiscal year 20, which we had 86. 81 reported public guardian clients passed during the state fiscal year of 2020. At the end of third quarter fiscal year 20, there were 57 people that had passed. Moving on to updates on COVID. To date, we have reported 28 public guardian clients that have been diagnosed with COVID-19. And these are clients that had active court orders. 19 of these people have tested positive, but were asymptomatic. 2 people tested positive, recovered, and then unfortunately tested positive again, and they were asymptomatic. We have shown that 30 of the public guardian clients have recovered and 4 clients have passed. Updates on client visits. In early March, DARS recommended that local public guardian service providers suspend face-to-face visits with clients that were living in congregate settings and with clients residing with sponsored residential providers. This early action was taken in conformance with the no visitation policies that have been adopted by long-term care facilities. Public guardian providers have maintained close contact with clients during the crisis. At a minimum, guardian representatives are speaking with each client via telephone or video chat at least once a month. The providers have indicated that most clients are contacted twice a month and that many of our guardian representatives are actually contacting each of their clients weekly. In some cases, of course, it's not possible to communicate directly with the client, and in those cases, the guardian representatives are contacting the caregivers of the residential providers. DARS has advised the programs that we will not enforce the in-person face-to-face visitation requirements of the contract until February 1st, 2021. However, DARS does encourage the guardian representatives to conduct in-person face-to-face visits if it can be done safely. As a guideline, DARS referenced the Virginia Department of Health guidance when nursing homes can reopen to visitors. VDH, in conjunction with CMS, which is the Centers for Medicare and Medicaid Services, has developed a system of phased reopening of nursing homes to visitors. To allow visitors, a nursing home has to be in phase 3. To achieve phase 3 status, the surrounding community has to have been in phase 3 for at least 2 weeks and the facility cannot have had a resident with a positive COVID diagnosis for 4 weeks. A facility that is in phase 3 will go back to phase 1 if a resident has a positive diagnosis. Visitation must be suspended if the surrounding community loses its phase 3 status. If a staff member tests positive for COVID, visitation must be suspended until the facility has been COVID-free for 14 days. The Department of Social Services has recommended that assisted living facilities also utilize the same standard. Things are always changing, and on September 17th, CMS announced guidelines that would allow nursing homes to reopen to all visits sooner. And this is based on a recognition that isolation from family and other support providers also can have serious negative consequences for long-term care residents. The new CMS guidelines will allow visitors wearing proper PPE into long-term care facilities if the facility has not had a positive COVID case for 14 days and the surrounding community has a positivity rate of 10% or less. The new guidelines further recognize that compassionate visits in situations in which the facility is otherwise precluded from allowing visitors, which has largely been construed to mean end-of-life visits, should be interpreted somewhat more broadly. Nearly all nursing homes in Virginia are still closed to visitors, but this new policy should make it easier for public guardians to resume visits when the infection rate at long-term care facilities decline. DARS will revise its guidance to the local public guardian service providers based on guideline changes that are issued from the Virginia Department of Health and the Department of Social Services. PPE updates. DARS has provided enough PPE to each program to make 6 visits to each client. We have also provided disposable KN95 masks and nitrile gloves. Additionally, we have provided each guardian representative with 3 reusable face shields and 3 disposable lab coats. We have also provided each program with hand sanitizer. COVID-related training. DARS arranged a presentation to the local programs from the Virginia Department of Labor and Industry to explain the VDOL's emergency COVID regulations and how they apply to local programs, each of which is an employer that's covered by these regulations. DARS also arranged a presentation on safe use of PPE by a Virginia Department of Health trainer. I am currently working with our programs and DBHCS to finalize a universal intake form that will be posted on our website. Patty and I had a conference call with DBHCS on Thursday to review the form and to incorporate, of course, any necessary additional edits that will be needed. We are planning to have the form ready for use in October. It will be placed on both DARS and DBHCS website. Unfortunately, we did have to cancel the in-person statewide training that was scheduled for October in Virginia Beach. Instead of doing in-person training, of course, due to COVID, we will be doing virtual training. So we will have presenters that will be presenting remotely, and this is going to actually take place over a couple of months, beginning at the end of October. We have also finished a video on the Public Guardian Program, which features many of our providers, a volunteer who serves on our multidisciplinary panel, a couple of our residential providers, Dr. Pam Teester, and a client who has been restored to capacity. And George is going to share that at the end of the board meeting today. I know that was a lot of information from Patty's report. Does anyone have any questions? Okay, well, thank you.
Thank you, Betty. We appreciate your time. I think the next thing on our agenda is the Public Guardianship and Conservator Report 2019 Biennial Report. Has everyone had a chance to review that? I think it came in attached to one of the meeting notices. We need a motion to adopt, unless there's some questions or changes.
Yeah, just one change I'm going to note, Rose, is that the date of the letter will be changed.
Thank you. Anything else? Can we have a motion to adopt?
This is George. I second the motion.
Roll call?
Yep. Okay. Jim Almond?
Which, yes.
Kathy Harkey?
Yes.
Monica Karavanek?
Yes.
Kimberly King?
Yes.
George McAndrews?
Yes.
Rose Palmer?
Yes.
Angie Phelan?
Yes.
Tara Ragland? Tara, you might be muted. I'll move on. LaTroy Roxburgh?
Yes.
Christy Zed?
Yes.
Great. That was a vote to approve and adopt the 2019 Public Guardian and Conservator Advisory Board report to DARS. So I'll change the date and we can submit it.
Thank you so much, George. Appreciate that. The next thing on our agenda is the 2021 meeting calendar.
There we go.
No, it's there somewhere.
Everybody see that?
Yes.
Great.
You need a motion to adopt?
So there was a proposal to shift the meetings from Thursdays to Tuesdays. And we did have some possible dates for that, which would be March 16th, June 22nd, September 21st, and November 9th. So I guess that needs to be, first of all, decided whether we continue meeting on Thursdays or whether the shift to Tuesdays is acceptable.
That was my question too.
This is Monica. I have no preference.
This is Angie. It doesn't matter just as long as I know far enough in advance to get it on the calendar.
Okay. Does anybody have any objections to moving to Tuesdays?
This is George. Can I just ask, what time will we be having them? Will they be morning meetings or afternoon meetings?
So they will be morning. So this was as you may recall, we were unable to hold the meeting on September 3rd due to the technical issues. So typically we'd be meeting at 10 a.m.
Okay.
And this is Christy Zed. I have a conflict on the first Tuesdays of the month, but that would be, I'm not sure, because you made some changes to these dates, correct? Because this is Thursday, so.
Yeah, let me just show you the, these would be the proposed dates. All Tuesdays, and I don't think any of them are the first Tuesday by looking at it.
Okay.
It's either the second or third typically.
Okay, then that works for me.
Okay.
Tuesdays are better for me as well. So if I would like to have it on Tuesdays.
Okay.
Well, I'll join. This is George. I just took on a Thursday morning commitment once a week, but I can work around it. But if others like Tuesday, I'd rather have Tuesday.
Tuesday mornings are good for me as well. This is Kim.
All right. Well, sounds like we can move ahead with the vote to adopt the calendar as amended for these dates: March 16th, 2021, June 22nd, 2021, September 21st, 2021, and November 9th, 2021.
This is George. I move that we approve it.
This is Monica. I second.
All right. I'll do a roll call. Jim Almond?
Yes.
Kathy Harkey?
Yes.
Monica Karavanek?
Yes.
Kimberly King?
Yes.
George McAndrews?
Yes.
Rose Palmer?
Yes.
Angie Phelan?
Yes.
Tara Ragland? I might have lost her. Latroy Roxburgh?
Yes.
And Christy Zed?
Yes.
Great. So that was a unanimous vote to approve the calendar as amended.
Will this updated calendar be emailed out to everybody?
Yes, I'll do that when I send out some follow-ups later today or tomorrow.
Thank you.
You're welcome.
Is there any new business that we need to discuss?
I've got two things, actually, if I can jump in there. So the first, just to let you know, I've been working on revising the bylaws for the board. I've done a draft revision, and these have gone to our policy area to review. And once they come back from there, I'll send them out to everybody ahead of the next meeting in November. So the current bylaws require that we have any changes tabled at one meeting when they're open for discussion and can be amended. And then a final version is presented at the following meeting. So that would be the meeting in March for approval. So I'm just flagging that as an upcoming thing, and so we'll have that on the agenda in November, right, Rose?
Thank you, George. I knew there was something coming up on that. And there's also some discussion that you and I had about possibly doing a training on new ways of handling the meetings.
Meaning, sorry, I'm not.
It had to do with training that the DARS folks got a while back. It's been months now. With COVID, everything's gotten crazy. I'm trying to remember.
Yeah, so we've adopted most of those things already.
Okay.
Kind of organically. So they were things like not needing to take a vote to approve the minutes. Not needing a vote to adjourn the meeting. And then there were some more specific things around FOIA, which we've already incorporated. So If we were meeting in person, we would be having a public comment period at the beginning and end of the meeting. But since we're meeting electronically and public comment has to come in before, we're not doing that yet. But so there were a few other things that may pertain only to in-person meetings. And just to also let you know, the reason we're reviewing the bylaws is because they're out of sync with the code, and there's some quirks that Doris, as a result of that board training, the policy department created a template for all of our boards and councils to use for their bylaws. So I'm trying to bring ours into alignment with those as well. And the other item of new business I have was the video, the public guardian video. You happy for me to go ahead and show that?
Yes, would you like to share that, please?
Yep. So I hope this will work. I haven't tried sharing a video yet on, oops. Everybody see that okay?
Yes.
Yeah, okay. And
the Virginia Public Guardian and Conservator Program was created by the Virginia General Assembly in the 90s to provide public guardianship services to individuals who are incapacitated, indigent, and who have nobody else to serve in the role of legal decision maker. It's operated through DARS, the Virginia Department of Aging and Rehabilitative Services. Guardians are unlike any other job. It's not social work, it's not exactly law, it's not medicine, but it has vestiges of every single bit of that. DARS contracts with 13 entities across the Commonwealth to actually provide the guardianship services, and they become the guardian. DARS has funding for 1,049 plus. The individuals who serve have nobody else to make legal decisions for them. The impact of having a guardian in your life is it affords a person to express their needs, it affords them to express their wants, and it provides an avenue in order to get those things that they need and they want and to improve their quality of life. When people don't have guardians and need them, they are homeless. Some of them commit crime. Sometimes they are abused. And public guardianship, while it cannot change behaviors, can help address some of those problems.
You've had people not have access to medical care that they needed until they had a legal guardian appointed. So, it is life-saving.
In Virginia, there are over 10,000 people under guardianship. Only 1,000 of them have a public guardian. The remainder of the guardians are private guardians, and they're typically family members or private attorneys who've agreed to do the work.
I see the public guardians being very much involved, where I've worked with some of the professional or private guardians where I might see them once a year.
So while all guardians, both private and public, are subject to the court order, which describes their powers, public guardians have additional duties, and they are the only group of guardians in Virginia who are regulated.
The great things about Virginia's program that is unlike almost any other are the very features that got into the law, in the law. That was the ratio 1 to 20.
How do we accomplish person-centered planning? DARS does that by having a low client-to-staff ratio for public guardians and requiring the once-a-month visit with each client.
And then we do the annual reviews. We sit down with the representative and make sure that everything is being done appropriately. And we help resolve issues that come up, look down the road, and help the programs run more smoothly.
So they really have to have an assessment. They really have to review it. They really have to have a values history. No state has anything like that.
When we
we act as a guardian for an incapacitated adult. We visit them. We make sure that their medical care is taken care of. They make sure their benefits are in place. We get them to the best possible living situation that they can afford. Make sure that they have clothing and food, and that they feel that they have a person in their life they can count on.
I believe that a guardian needs to be empathetic and patient,
have very strong communication skills,
kindness, compassion, knowledge of the system, the legal system, the financial system, social service system, medical system.
To see, are their clothes fresh? Do they need some new shoes?
Come and see you if you don't want to take your medication. Setting up services, outside resources,
Being ready to answer the phone any time of the day or night. And the willingness to listen to others.
To dig deeper, not just do what's necessary to make decisions for people.
You will need tough skin.
You have to be ready to go into battle. We work with so many other agencies.
We deal with transportation companies,
all of the Medicaid managed care organizations,
attorneys,
Department of Behavioral Health and Developmental Services,
job coaches,
dentists,
group homes,
banks, vital records,
Social Security,
the doctors, the psychiatrists, the psychologists, and of course, nursing homes.
It's a multitude of things that a guardian does. And we try to put them in one box, but it's not that simple.
The public guardianship program requires that our guardians use person-centered planning, also that they visit clients at least once a month, and that is the minimum. So what they become is the constant.
Having somebody who has that patient's interest at heart, who has the authority under the law to consent to what they need for their treatment, is a really important part for us.
Guardians and conservators are legal decision makers. All guardians and conservators have a fiduciary duty to act in the best interest of the incapacitated person.
We are working for them, but we are going to be a consistent face throughout their lives. It's easy to make this feel familial.
So having that person-centered planning is really helping the person come up with a plan that's going to address all the things that are important to them, as well as the things that are important for them.
And they think through what that actually means. So it's not what the guardian thinks would be good, it's what the client thinks would be good.
I have witnessed clients engage in care plan meetings. They have mentioned wanting to get jobs, wanting to volunteer, wanting to be more active.
The misconception is that guardianship is for the rest of a person's life. While that is typical, because most of the things that lead somebody to be incapacitated are irreversible, it's not always true. And in that case, we can bring the matter back to court and ask the judge to restore the individual to capacity.
I basically met my first guardian in the hospital. Yeah, we hit it right off. She was always been a lot of experience and stuff. Like, we're just like family.
They want people to do well, but then they think through what that actually means. So it's not what the guardian thinks would be good, it's what the client thinks would be good.
She always said your goal is to get out of the hospital, right? I said, yeah. And your goal is to be on your own, yeah. And I succeeded in all of that.
We're not able to be their voice unless we truly understand them and we can stand in their shoes.
But I have my own apartment. I've been in my own apartment for 4 years. And, I pay all my own bills.
What DARS measures are the superficial metrics governing the program, which, while they are important, are not the heart of the program. The heart of the program is the relationship that our guardians develop with their clients.
One of the ways I think public guardians really add to the life of the individual is they develop a real relationship and knowledge of that person.
Have to care deeply. I mean, that if you don't, then it is very hard to stay motivated.
I felt like I've been sleeping all my life until I got this job.
Individuals at the hospital at 11 o'clock at night, that guardian came out, to help make decisions on the spot.
Individuals are really happy to see their guardians and show off things like their Special Olympic ribbons and you know, awards that they may have received when they were at work.
I've been seeing this client for 4 years. And then I walked into the group home where she lived, and she grabbed my hand, and she put it to her heart. And the day that she did that, I mean, they could have just knocked me over with a better.
He always cared about me as a human being, you know. I said, if I hadn't had them, I guess I wouldn't have made it to where I am today. You know?
All right, well, thanks to Patty, Betty, and the team.
Good afternoon, good morning, everyone, and welcome to the second webinar.
Thanks to Betty and Patty and the team for putting that excellent video together, and I'll be sending a link to everyone with the follow-up email.
Thank you.
Nicely done. This is Angie. I was going to say it was a very nicely done video.
Concur. Moving on, is there any old business we need to address? If not, our next meeting date is November 19th, 2020.
That's a Thursday, just.
And that'll also be at 10 a.m.?
It should be,
That
yes.
will be at 10 a.m., yes.
Repeat that date, please.
November 19th, 2020. Are there any other questions or concerns? Anything else we need to discuss? George, if I'm not missing anything, it's time to adjourn our meeting.
Sounds good.
Thank you, everyone, for taking part today. And I know we had a lot to go over, and I appreciate your time.
Thank you.
Good day, everyone.
Hope to
Thank
see
you, everybody.
in person soon. Bye.